Welcome back everyone, Dr. Shad here, and in this video, we'll begin our discussion of removable partial dentures. More specifically, we'll go over Kennedy classifications and rests. But before we do so, let's quickly go over the difference between stability, retention, and support. Retention is the resistance to displacement of the denture base away from the ridge. Stability is the resistance to horizontal and rotational forces. And finally, support is the resistance to vertical forces towards the ridge. The design of an RPD is based on the Kennedy classification system. Kennedy Class 1 describes situations where there are bilateral edentulous areas posterior to the remaining teeth. Kennedy Class 2 is when there is a unilateral edentulous area posterior to the remaining teeth. Now, I always found these two to be a bit backwards because I think it makes more sense to flip these two classifications so that Class 2 refers to two edentulous areas, but alas, I'm not Kennedy, so we'll stick to the way he wanted it. Next up is Kennedy Class 3, and here we have a unilateral edentulous area with remaining teeth anterior and posterior to it. Finally, Kennedy Class 4 is when there is a single bilateral edentulous area anterior to the remaining teeth. Now, when I say bilateral, I mean that this edentulous area must cross the midline in order to be considered a Kennedy Class 4. Alright, so Kennedy came up with the classification, but then came another guy, Applegate, and he introduced a bunch of rules to make it easier for us to use the Kennedy classification. Funny enough, these guys never worked together directly, but they both had the same first name, Edward. So if your name is Edward, I highly recommend you to go into Prosthodontics and name something after yourself to complete this trilogy. Alright, on to the rules. Rule number 1. Classification follows extractions, meaning that the edentulous area or the arch is given a classification once the necessary teeth have been extracted. That makes sense. Rule number 2, the third molar is not considered in the classification if it is missing and not to be replaced. Rule number 3, the third molar is considered in the classification if it is present and to be used as an abutment. That makes sense as well since it's already there, so we may as well use it. Alright, rule number 4, the second molar is not considered in the classification if it is missing and not to be replaced. Same as rule number 2. Rule number 5, when there are multiple edentulous areas, the most posterior edentulous area determines the classification. Rule number 6, edentulous areas other than those determining the classification are considered modifications. So a modification is any additional edentulous space in the arch. Rule number 7, the number, not the extent of the modification is considered. So let's say you've determined the classification and there's one other edentulous area in the arch that is missing, I don't know, let's say 2 teeth. Then that would be modification 1. It doesn't matter that this additional edentulous area is missing 2 teeth, it's only considered one additional area. And finally, rule number 8, there are no modifications in Class 4 arches because a Kennedy Class 4 only has one edentulous area. And that should make sense because if there were an additional edentulous area posteriorly, then rule number 5 tells us that it will take precedence in determining the classification. Alright, now that we've gone over Applegate's rules, let's classify some arches together. A Class 1 classification as seen in this image has bilateral edentulous areas posterior to the first premolars and no other edentulous space. With Class 1 Mod 1, we have bilateral edentulous areas and one additional edentulous space. And you guessed it, with Class 1 Mod 2, we have bilateral edentulous areas and 2 additional edentulous spaces. Nothing crazy here, guys. Moving on to the Class 2s. We have a unilateral edentulous area posterior to the first premolar and no other edentulous space. With the addition of a modification space, we still have one unilateral edentulous area plus one additional edentulous space. And finally, Class 2 Mod 2 has a unilateral edentulous area and 2 additional edentulous spaces. Easy peasy. Moving on to an example of a Class 3 situation, we have a unilateral edentulous area with remaining teeth anteriorly and posteriorly. Class 3 Mod 1 has the same unilateral edentulous area with one additional edentulous space. And finally, Class 3 Mod 2 has the one edentulous area and 2 additional edentulous spaces. Our last one is the Class 4 classification, which as shown here has a single bilateral edentulous area anterior to the remaining teeth that crosses the midline. Again, it's important to remember that a Class 4 cannot have modification spaces because any additional edentulous areas would have to be posterior to this edentulous area shown in blue. And based on Applegate's rules, we use the most posterior edentulous area to classify the arch. So in this situation, the classification would change entirely. It would now be considered a Class 3 Modification 1. Alright, enough of the Edwards. Let's move to an actual component of RPDs, rests. When fabricating RPDs, it's important to create proper occlusal rest seats so that the occlusal rest of the RPD can provide sufficient support for the prostheses. Now, you'll want your rest prep to be inclined towards the center of the tooth so that we can direct the forces along the long axis of the tooth. You'll also want your prep to ideally be on a posterior tooth because posterior teeth are larger and stronger, making them better able to take on the load. Now, rest seats can obviously be prepared on canines as well, but posterior teeth are much better suited. Okay, in terms of dimensions, there are a few numbers you have to remember. From a mesiodistal perspective, you want your rest seat to cover a third to about half the width of the tooth, here denoted by the letter A. From a buccolingual perspective, you want your rest seat to cover half the width of the tooth, but measured from cusp tip to cusp tip, denoted here by the letter B. You also want to make sure that your rest seat prep has an outline form of a rounded triangle. This will be important for the fabrication process. Finally, you need your actual rest once fabricated to be about 0.1 millimeter away from the opposing tooth. And you may say, 0.1 millimeter, what the heck? That doesn't seem practical to measure. And you're right. So all you need to know is that the rest cannot be involved in occlusion. Just make sure that it doesn't touch any opposing teeth in any mandibular movements and you'll be fine. Okay, so now you know how to prep a rest seat properly, but what about where to place it on the tooth? Well, there are two main categories of rests, mesial rests and distal rests. Mesial rests create a more favorable distribution of occlusal forces. They reduce the torque on the abutment teeth and minimize stress on the periodontal tissues as well. Whereas distal rests can result in torquing of the abutment tooth, which can over time cause distal tipping and drifting. Ultimately, they can be very damaging to the teeth and the surrounding periodontium. Another important concept when it comes to rests and rest seats is the supportive fulcrum line. The supportive fulcrum line is an imaginary line that connects the terminal rest of an RPD and acts as a fulcrum point or a point of rotation for the RPD. Now, why is it important? Well, in Kennedy Class 1 or 2 cases, this line tells us where to place another rest, or as we call it, an indirect retainer to prevent the rotation of the distal extension portion of the RPD. And generally, you want this indirect retainer to be on a tooth that is perpendicular in position to the supportive fulcrum line, or as close as you can get it. In the case of a Kennedy Class 1 seen on the left, we know we can't add an indirect retainer on the central incisors, so the best bet would be to add 2 of them, one on each canine. Okay, now for my favorite part, I get to quiz you guys with some practice problems. Question 1. Given the following edentulous arch, what is the Kennedy classification? Class 1, 2, 3, or 4? And the answer is Class 3. Because the patient is only missing tooth number 8, the edentulous area is not considered bilateral, nor does it have teeth on only one side of it, and nor does it cross the midline, so it can't be Class 1, 3, or 4 respectively. I tried to trick you guys with this one. Alright, moving on to question number 2. Given the following edentulous arch, what is the Kennedy classification? Pause the video if you need. And the answer is B, Class 2 Modification 1. Even though the posterior edentulous area is crossing the midline, we don't really care. It's still only unilateral. And so it's a Class 2 with an additional edentulous area, making it a Mod 1. Alright, question number 3. Given the following edentulous arch, where should the occlusal rest seats be prepared? On the cingulum of the canines, on the distal aspect of the second premolars, on the mesial aspect of the second premolars, or on the lingual surface of the lateral incisors. Take a second if you need, but the answer is C, on the mesial aspect of the second premolars. Remember guys, mesial rest seats create a more favorable distribution of occlusal forces, they reduce torque on the abutment teeth, and they minimize stress on periodontal tissues. Posterior teeth such as the premolars allow for forces to be better distributed along the long axis of the tooth. Alright, moving on to the next question. Each of the following complicates the design of an RPD intended to replace maxillary molars in a Kennedy Class 2 scenario, except one. Which one is the exception? Definitely pause the video for this one, guys, because you really need to visualize the situation to understand what's happening and make sure you understand the option choices as well. Once you've done so, you should have your answer, which is A, periodontal disease of anterior teeth. This one's a bit tricky, but it's very important for you guys to understand the concepts here since I didn't discuss them directly in the video. First things first, to know which option choice will complicate the design, we need to, well, know what the design looks like. Kennedy Class 2 cases are unilateral distal extensions, but remember guys, just because the edentulous area is unilateral, it doesn't mean our design will be. RPDs are always cross-arch stabilized, and so you'll certainly need RPD components that will extend all the way to the other side of the arch. That means rests, minor connectors, and major connectors as well. Alright, with that said, let's go through our option choices. Proper occlusal rests are certainly needed for an RPD to be successful, so their absence would absolutely complicate an RPD, so B is incorrect. And as I mentioned just now, we're going to need rests on the contralateral molars as well, so the health of the posterior teeth, along with their associated periodontal tissues, is a must, so C is incorrect. Finally, super-erupted opposing molars will result in inadequate restorative space and instability, so they'll complicate any RPD you'll ever design. The only option that stays clear of our anticipated design is A, because in this situation, we really don't rely on the anterior teeth for anything. Now you may say, well, wait a minute, Shahid, don't we need an indirect retainer to be placed on the canine, which is an anterior tooth? And if you thought about that while answering this question, firstly, I gotta say, well done. That's a great thing to have kept in mind, but remember, posterior teeth are better suited for rests compared to anterior teeth. So whenever possible, we want to utilize them over anterior teeth. And in this case, the contralateral premolar, tooth number 5, will be our best bet for an indirect retainer. Alright guys, that's it. Here's a quick summary of the high yield points we went over. Thanks for watching and see you next time.